Start this evening on the coronavirus front. State health officials are now monitoring a potential increase of COVID-19 cases, just as we've been seeing some relief. WDHN's Alex Valdez joins us now from the newsroom. Alex?
Amanda, this week Alabama reaches a 2-year milestone in the COVID pandemic, and hospitalizations in the state are showing dramatic improvements in the number of cases. However, medical experts are monitoring warning signs of yet another wave of COVID-19 infections. According to the CDC, more than 1/3 of its wastewater sampling sites have seen a spike in the virus, an increase of at least 100% in the past 2 weeks, which could hurt the current COVID situation in Alabama.
We are now back pretty much to where we were in late November, early December, before the Omicron surge.
Medical professionals believe the use of monoclonal antibodies, antiviral medications, and other resources were game changers in the pandemic, helping put a cap on COVID-19 hospitalizations in the state during both the Omicron and Delta surges, and could be vital in future surges.
Most troubling of all, we don't control the ability of the virus to mutate. And we're already seeing clearly mutations of a new variant that is now driving up infections in China and again in the UK and in Europe.
Medical experts are keeping an eye on the BA.2 variant that spreads 30% faster than the Omicron variant. As of now, 20% of COVID cases in the US are BA.2. However, in the UK, BA.2 accounts for more than 50% of COVID cases, which is why the big question now is how another variant might impact the state's healthcare system.
As long as there's enough immunity, as long as there is enough protection, so that doesn't lead to a surge in hospitalizations to the level we've seen before, it won't compromise our healthcare system in the same way.
Medical experts say even though the state is seeing low COVID numbers now, they want to encourage Alabamians to remain cautious so these numbers can continue to trend downward, giving hospitals a chance to brace for another possible surge. Amanda?